Welcome to Sculpting the Soul, where we explore the art and science of transformative surgery. I'm your co-host, Courtney Shaw, and today I'm thrilled to introduce an incredible surgeon and our esteemed host, Dr. Kalus. With nearly 35 years of experience, Dr. Kalus has seamlessly blended his passions for artistry and healing. Growing up immersed in theater, he brings a unique perspective to plastic surgery. Combining creativity with surgical precision, board certified by the American Board of Plastic Surgery since 1992, he's dedicated to helping his patients achieve their aesthetic goals while maintaining a natural look. Because the best transformations are the ones that remain beautifully discreet. In this podcast, we'll explore the latest advancements in plastic surgery, share inspiring stories, and answer your questions. Get ready for a powerful journey of transformation with Dr. Kalus. Dr. Kalus, hi, how are you?
I'm great. Thanks, Courtney.
Very good. So we're going to start off today with really understanding why this podcast is called Sculpting the Soul.
Well, I think we came up with that name, honestly, Courtney, because when we think about what doctors do, we're oftentimes curing disease, diagnosing and treating. And a lot of that has to do with our health, longevity, wellness. But so much of what we do as plastic surgeons is not really related to longer living, but better living.
Right.
And Sculpting the Soul is kind of mixing in the fact that we're working with our hands and really changing faces and body parts, whether it's breast or tummy or contouring the body. And I really do envision that in many ways, without sounding too highfalutin, we are calling upon artistic skills where the medium is not clay or wood or stone, but it's the human body.
Right.
And we really have to understand the anatomy in order to make sure that the blood supply supports what it is that we're doing by moving tissues around, with our goal ultimately being that we leave the patient looking terrific, but not as though they ever had surgery in the first place. Now, with the body, it's a little bit easier to conceal scars because they're under clothing most of the time. But in the face, you really can't conceal anything. So
Right.
we have a particular challenge in trying to, for example, reconstruct a facial defect that either comes from trauma or from skin cancer or from a birth defect, and trying to re-sculpt that face and reconstruct that face and enhance it to appear normal,
Right.
which is what we all want to appear. Those of us who are fortunate enough to look beautiful or exceptionally handsome, that's great. But most of us definitely want to appear on the spectrum of normal.
Right.
And that is, and so that's the sculpting part. The soul part has to do with how we feel about ourselves. And honestly, Courtney, I'm not sure what it's like on Mars, but I know that on planet Earth, what we look like tends to matter.
Yes.
It matters to us with regard to how we feel about ourselves. And it also matters to us in terms of our confidence level as we interact with others.
Right. So when I first met you, that was something that I loved and really resonated with me, is the Sculpting the Soul was, yes, of course, the things internally that you are going to enhance and overall sculpt, but really it was about creating a better self, right? Internally and externally.
Exactly.
So when you talk about all the fields that doctors can partake in these days, what made you really stick with the field of plastic surgery?
So it's interesting, you know, when we're little kids and we're around with the relatives and the uncles who might be annoying, and somebody pats us on the head and says, "Hello, little Timmy, so what are you going to do when you grow up?" And as long as I can remember, when I got that little pat on the top of my head, I said doctor, and I don't know why, but it was the truth. That's what I was saying.
Right.
I remember that. I don't know where it sort of first descended upon me. But then as I matured and sort of had a general sense that I wanted to be a doctor, in high school, I had a pivotal experience. And I thought before this pivotal experience, which I'm about to tell you about, I always thought I might be a family doctor or a pediatrician because I do have an affinity for children. I have children of my own, and I love kids. They're always fun and interesting, and you never know what's going to come out of their mouths. So, and then I like the variety that a family practitioner might have because all ages, both sexes, different problems.
Right.
And so, ironically, plastic surgery, although it's a subspecialty, it's a surgical subspecialty. Another way to look at it, it is the most broad of the surgical subspecialties because we really do operate on all parts of the body, and men and women, children and adults. And so it's very, very broad. Now, what got me to plastic surgery specifically was in your intro, you alluded to the fact that I grew up in kind of an artistic household, which I did. Lots of music and art and theater and literature. So I was immersed with that as a child. And I think I had a certain proclivity toward an artistic and aesthetic sensibility. And then in high school, just randomly, I saw a special on public television. It was by the Nova series. Some of our listeners may know what that is. I think it's still running. And it's usually kind of a really interesting series about nature and science, sort of similar to National Geographic, but they cover all kinds of subjects.
Right.
And this particular Nova special was about a very specific portion or part of plastic surgery called craniofacial surgery, which has to do with surgically modifying the face and skull of infants and children, mostly to allow for brain growth, but also to allow for proper facial and skull development. And when I saw this 1 hour special, it captivated me. I was about 16 or 17, and I realized that's my calling. That is what I needed to do. And I ended up training and pursuing my goals and dreams and actually meeting both of the landmark surgeons that were featured in that show. And I was able to follow my dreams, for which I'm forever grateful.
Yeah, what an incredible story. I absolutely loved hearing that about you. And I think it really does allow us to uncover, for lack of better words, who you are, why you are doing what you do, and that it's not just every day you wake up going to the office, but you're going with a purpose. I love that. So how do you balance the artistic and scientific aspects of plastic surgery within your practice specifically?
So that's a great question. And I think that in medicine, we tend to be super focused on diagnoses. And I remember, certainly as a medical student, but definitely as an instructor and as an attending, I really always try to emphasize to my medical students, that is not a gallbladder in room 6. That is Mr. Jones, who has an inflamed gallbladder.
Right.
That is not a breast cancer. That is Mrs. Smith, who has the diagnosis of a breast cancer and how we're treating her. So never forgetting that we're seeing the patient and then seeing things holistically. And this is going to get to your aesthetics. I like to, first of all, meet patients and get to know them and understand them, but I like to see macro before I focus in on the micro. And the macro is, who is this person? Why are they here? What bothers them? I make no assumptions. And I want to hear from the patient in their own words what they're hoping to achieve by coming to consult with me. And the aesthetics, I really do believe that a sense of aesthetics is critical in a plastic surgeon, because we have to understand concepts like facial harmony and age appropriateness. We're all familiar with facelifts that are overdone, and usually women, but patients who look super tight,
Right.
and perhaps not able to express themselves the way they're supposed to. None of us want wrinkles, but our muscles of facial expression are supposed to be able to move so that somebody knows if we're smiling or happy or sad.
Yeah.
And unfortunately, with a lot of what's done, whether it's surgical or injectables, patients can have really kind of frozen, almost expressionless faces
Mm-hmm.
that may look good statically in a picture,
Right.
but they're not moving very well. And if they're
Mm-hmm.
not expressing themselves very well, we're shortchanging them because
Right.
we're human beings that have to interact in conversation and show our emotions and expressions. And so I think getting that appreciation of the aesthetics of a face and then getting to the scientific aspect of what you
Right.
asked me, there's nothing that we can do without understanding completely the anatomy and the blood supply to
Right.
make sure that whatever we do with our surgical instruments is actually going to heal
Right.
well without complications.
Of course. Going into that, out of an array of different categories in the medical field, why plastic surgery? What is the name behind the meaning, or the meaning behind the name, rather? Talk a little bit about plastic surgery and its actual meaning.
Right. So I think there's a lot of misunderstanding about plastic surgery where listeners might think it has something to do with plastic.
Right.
And we all know that the expression, oh my God, she looks so plastic.
Mm-hmm.
So that has a negative connotation.
For sure. Yeah.
But the term plastic surgery shouldn't have any negative connotations. Unfortunately, it may, because oftentimes things are overdone. We've all heard of the plastic surgery addict who just keeps trying to improve themselves.
Right.
And I will say about that that's also a critical part of what we do. I happen to have majored in psychology as an undergrad. So I think the emotional makeup of my patient is just as important to me as what it is that they're here to see me about.
Right.
And there are going to be good candidates for surgery, which fortunately most people are, but there are also going to be people who I don't consider to be a good candidate. Someone who has some real psychic unrest and are very, very unhappy and unstable. I want to get a sense for that because they might need therapy well before they need my services as a surgeon. And it's a delicate balance. There's no hard and fast. But I do think that it's important to understand where the term plastic surgery comes from. So it comes from the Greek root plastikos, spelled with a K, and that term means to change form or shape.
Okay.
And the material plastic, which we're all familiar with, is called plastic because it's malleable. It's flexible. And so even though we use some synthetic materials like a silicone breast implant or a polyethylene chin implant, there are things that we use that are synthetic that can be broadly termed plastic, even though they're not technically plastic.
Right.
The term plastic surgery has much more to do with simply modifying or morphing the shape of the face or body. And it doesn't have anything specific to do with synthetic materials.
That's wonderful. So I love how you talk about changing them, not only visually changing them, but it also, everything that you do ties back to the name of the podcast, which is Sculpting the Soul. And so I truly love that you're wanting to know the person before you're wanting to work on the human, which leads me into the misconceptions, right? We live in a world where everything can be misconceived, and perception, unfortunately, a lot of times is reality.
Mm-hmm.
So tell me some of the biggest misconceptions in your industry specifically. We kind of already touched a little bit on kind of the preconceived notion of plastic surgery in and of itself. So talk about some of the bigger misconceptions that you run into on a day-to-day basis.
So I think the biggest misconception is that plastic surgery is only cosmetic surgery.
Mm-hmm.
That's really, really important.
Right.
Every plastic surgeon who is out in practice, regardless of the setting, whether it's a university practice or a private practice, anywhere from Hollywood to a remote suburb of wherever USA,
Mm-hmm.
they've all been trained in what we broadly term reconstructive surgery.
Right.
And that would be trauma, birth defects, burns, all those things. So our underlying training is in really complex surgical challenges, putting faces together, putting extremities together, et cetera, et cetera.
Mm-hmm.
The misconception about plastic surgery equals cosmetic surgery has to do with the fact that sort of the highest level of what we do in terms of demand
Mm-hmm.
is taking a completely normal, healthy person, perhaps a beautiful person,
Right.
and making them better. Or at least that is the request or the goal, enhancing somehow what is normal. And if you think about what the whole entire field of medicine is about. What brings us to the doctor's office usually is an abnormality
Right.
that we want to correct.
Mm-hmm.
Either we don't feel good, or we've got a lesion that we are worried about that might be a skin cancer, or we've got an open wound,
Right.
or we're just sick and we want to get
Mm-hmm.
fixed. So all of those are abnormalities. And what you want to think about in a lot of what we do as plastic surgeons, even though that is certainly part of what we do, for cosmetic surgery is a person who is fine and healthy, and they may have a feature that they would like enhanced or improved. So that really puts the onus of a major challenge on our part,
Mm-hmm.
that we're about to cut on somebody
Right.
who doesn't need an operation from a medical standpoint, but
Right.
we're trying to enhance their appearance. So it really calls upon a high level of expertise, both experience-wise and technique-wise, to know what we're doing. Um, and so that's one big misconception: cosmetic surgery versus reconstructive surgery. I think the other big misconception is that it's just for the rich and famous.
Mm-hmm.
You know, because certainly plastic surgery can be considered glamorous and sexy and sort of gossipy and celebrity who had what done.
Right.
But most of us are not celebrities, and most of us are not rich and famous, and all of us want to feel good about ourselves.
Mm-hmm.
So it's really a specialty that could potentially impact and is certainly available to almost everyone.
Right.
Obviously, cosmetic surgery isn't covered by insurance,
Mm-hmm.
so there has to be some element of financial means to be able to afford plastic surgery. But I don't think it would be correct on the part of listeners to assume that you have to be, wealthy to
Of
be able to
status,
afford cosmetic surgery if that's what you're seeking.
Yeah. So when we talk about the importance of just having plastic surgery in general, whether it's a need versus a want, ultimately I think it boils down to a desire, right? We all have the desire to look better, feel better, especially the world that we live in currently. So can you discuss the importance with me of achieving a natural appearance of someone who really may need the plastic surgery versus the person who wants it because they want to feel better, look better, but overall enhance something?
So my practice, Courtney, tends to sort of gravitate a little bit more toward the under the radar, natural look.
Mm-hmm.
My patients, and I don't know if it's just an evolution over 35 years of practicing, but because my philosophy has really always been to try to achieve a very natural look that is under the radar. A lot of folks say, I'm digressing for a moment, but a lot of folks say that a plastic surgeon really needs to be part artist. And I'd say that's probably true, as we talked about a minute ago, about an understanding of aesthetics. But the difference between a plastic surgeon and a true artist is that an artist signs their work.
Mm-hmm.
And I want my signature to be completely invisible. I don't want any of my patients to have the equivalent of a flashing sign on their forehead saying, I had plastic surgery by Dr. Kalus.
Right.
If they choose to tell the whole world about it, that's good for me for marketing.
For sure.
And it brings more patients in if they're
Yeah.
really happy.
Right.
But I don't want it to be obvious if they're standing on a supermarket line
Yeah.
that they had plastic surgery. I want it to be completely understated. And the goal is really the patient's level of satisfaction. And Courtney, this brings up another point. We talked about how it is on Mars, and we're not sure how that is because we've never visited. But when we are happy about ourselves, we project that positive energy. And the opposite of that is also true. If we're thinking about, oh, my nose is too big, oh, my breasts are droopy, oh, my thighs are too wide, if we're thinking about that, even if we're not consciously thinking about it as we walk out the door, it's almost like a little shoulder bag we're carrying with us all day long. And even though it may not be front and center 24/7, it's part of our makeup. And if we correct that thing, whatever it is that is bothering us, it can almost be liberating.
Mm-hmm.
Because now all of a sudden you're not thinking about what bothered you. On the contrary, you've got this newfound level of confidence, and then you're going on with your life and going through your job interviews and socializing and doing whatever it is that you do without that little annoying thing in the back of your head saying, yeah, but I'd be so much happier if I did this,
Right.
or if I had that done. So I think that's really the essence of what we do.
Yes, for sure. So as we, evolve, especially on social media, and we've become a TikTok generation and an Instagram generation, um, I think it's impossible not to compare yourself, especially as a female, right? And so we've gotten into, over the last few years, I was reading that the increase in mommy makeovers has been something that has hit the plastic surgeon world. I mean, it's really catapulted it, in lack of better words. So tell me what a mommy makeover is, and explain to me, for those who are listening, what that involves and entails.
So, pregnancy has some irreversible impacts on the body. And all of our listeners will know, male and female, because the partners also see what their female partners may be bothered by and thinking
Right.
about and maybe talking about. But the main areas that seem to be thought about with regard to mommy makeover is breasts and tummy. If a mother nursed one or two or three children, it's highly likely that her breasts are going to be different from before when she got pregnant. Tummy, same thing. The lucky moms are going to have a beautiful tummy, maybe a little bit looser, maybe a little bit more of a pooch, but something they're not necessarily embarrassed by.
Right.
The less lucky are going to have stretch marks and really a lot of overhanging skin, maybe some weight gain that never was able to get back totally to their pre-pregnancy weight.
Right.
So that's the tummy. With regard, and the other part of the tummy that I want to mention, if there was either a twin or triplet pregnancy or just a large baby, the muscles are permanently stretched out.
Right.
And exercise, including sit-ups and core work, would definitely improve it, but probably not necessarily get the mom to the body that she had before.
Right.
And she may need help with muscle tightening of the muscles, the so-called six-pack, and perhaps getting rid of some of that extra skin. That's the tummy part.
Right.
And before I forget that, there may be some body contouring elements, like a little extra fat in the hip rolls or in the flanks. So that can oftentimes be associated with some additional liposuction with the tummy tuck. The breast part, actually all bets are off on predicting, because we know that almost universally a woman's breasts are going to get bigger with pregnancy, and certainly with holding on to milk if she's nursing. And then when all of that is behind her and she stopped nursing and she's 3 months, 6 months, 9 months from having completed her nursing, the breasts are usually going to go down in size, and they will definitely have a little bit more droop and sag.
Right.
Now, a little droop and sag in a woman's breasts, it may not be desirable necessarily, but it's natural.
Right.
And it doesn't imply that the breast is less attractive. A lot of sag and a lot of droop it can be impactful on a woman, because even if she's not large breasted, if there's a lot of droop, the bra is working overtime to pick those breasts up.
Right.
And that can have impact on the shoulder straps, from where the shoulder straps of the bra dig in. And women with a lot of droop basically have too much skin for the amount of breast volume. The other thing that can happen that we've seen is women will say, I got pregnant, my breasts got bigger, and they stayed bigger.
Right.
That can also happen. So there are a lot of hormonal influences on the breast, more so than other parts of the body. And so the other pattern that we see is a woman might say to me, before I had babies, I was sort of a nice, pretty C cup. And now that I nursed a couple of kids, I'm barely an A cup.
Right.
And so we really see all patterns. Sometimes the volume isn't going to change much, but there'll be a little more drooping.
Right.
Sometimes the volume will go up and stay up, and sometimes the volume will go down. That's actually a term for that. It's called postpartum involution. Involution is the fancy medical term for getting smaller.
Yeah.
So we really see all of those. Now, those are the body aspects of mommy makeover. And I
Right.
want to remind our listening moms that we also know that sometimes there are going to be sleepless nights.
Yeah.
And when you're super mom, you're working hard, you may be tired, you may start getting some frown lines from poor sleep or worry.
For sure. Yeah.
And so the other elements that we do address is as we started by talking about looking at the patient globally, we want to address everything that's bothering the patient. and if she has some bags under her eyes or some worry lines and so on, all of these things can be talked about.
Right.
But a mommy makeover basically means before you were a mommy, you look this way. Now that you are a mommy, you look that way. How can we help you?
Right. So when you talk about those who are ready to take the next step in finding out more, or perhaps taking the next step in really discussing their overall plan from head to toe of what a mommy makeover looks like, what would you say is are the preparations that someone needs to take in order to begin the process of the mommy makeover? Are there some things you have to do pre-surgery, and then what does post-surgery look like and time being out?
So, um, the pre surgery is basically we encourage in all of our patients, regardless of whether it's a mommy makeover or a facelift or whatever, we want the healthiest possible patient.
Right.
So, following a healthy lifestyle, eating healthy, not smoking, drinking in moderation and not excessively, having a recommended amount of daily or weekly exercise, all of those healthy lifestyle choices are extremely important
Right.
for us as surgeons as we assess the patient's candidacy, for lack of a better word. Are they a good surgical candidate? That's sort of the pre. The post will depend on the surgery, but as a general statement, for the vast majority of major surgery that we do, my benchmark downtime is going to be about 4 weeks.
Okay.
Now, that doesn't mean you're in bed for 4 weeks and unable to move. It means that we don't want you hitting the track and jogging for 4 weeks.
Yeah.
Most of our surgery that we do for patients is outpatient. Rarely does the patient need to spend a night in the hospital. They're eating, they're drinking, they're walking immediately after
That's
surgery.
incredible.
The only thing I wouldn't want my breast augmentation patients to do is play tennis a day or two after surgery, because that's going to cause a lot of bouncing
For sure.
and stress, both on the breasts and on the pectoral muscles underneath, etc. From a tummy standpoint, anything that involves surgery, we don't want the patient's heart rate and blood pressure to go up very much, because that can bring on complications like bleeding and swelling and just delay the healing.
So when you talk about the pre that you need to do and you look at before a patient is a good candidate or may have a little work to do before they get to being a good candidate, is it true that a lot of those things that you mentioned, the non-smoking, drinking in moderation, will also help in recovery? You want to talk a little bit about just the recovery process internally versus the external that we just talked about?
Absolutely. So the idea of a good surgical candidate is someone in whom we don't see any reason why they would not be able to undergo surgery and heal well.
Right.
The patients who might have some issues are patients with heart disease, who are smokers, who may be on some medications that somehow put them at an immunosuppressed situation where they're more prone to infection or delayed wound healing, those kinds of things. The latter category of patients are the ones we tend to encounter in the hospital when some of our medical specialty colleagues consult us. Hey, Dr. Kalus, we've got a real problem wound in this very sick patient who's diabetic and got heart disease, and we take care of those patients routinely. But the elective cosmetic patient, whether it's a mommy makeover or a facelift patient, we want to see a healthier patient who's following our directions. That's very, very important. We are very explicit in the do's and don'ts.
Right.
And thankfully, there aren't that many don'ts. It's a lot of common sense.
Right.
The no smoking part, why smoking is such a risk factor? Because smoking reduces blood supply.
Okay.
The nicotine is constrictive, and the carbon monoxide that you're inhaling with your cigarette puff is actually preferentially kicking out the oxygen in your blood, and oxygen is the most important thing our cells need to heal. It's the most important nutrient that our body needs to function.
Right.
So the postoperative instructions really are fairly straightforward and self-explanatory, but healthy eating, exercise, ambulating to reduce the risk of a blood clot, for example. That's why I said you're not going to be in bed after surgery, because we need you getting up and walking around. We don't want you to put yourself at greater risk of developing a blood clot, for example.
Right.
But thankfully, the list of, oh my gosh, the do's and don'ts, it's fairly simple and straightforward in the vast majority of healthy patients.
Very good. And, you know, before the mommy makeovers became such a hit, and honestly, in tandem of both, GLP-1s are big in our world. So if someone has, or a listener is currently on a GLP-1 because they're trying everything to really get back to post-baby or pre-baby and what they looked like pre any kind of children, 1, 2, or 3 or more, what are the rules on that? Do they have to stop taking it? Talk a little bit about the GLP-1 listeners who are trying to find their journey, but maybe this may be the next step in helping them.
So, great question. So, indeed, GLP-1s have been revolutionary in
Mm-hmm.
terms of what they're doing. And most of what we know about them are very positive
Right.
in terms of reducing hemoglobin A1Cs, taking someone from pre-diabetic to not, certainly the weight loss elements for sure. So all of those things tend to be pretty good. The care, the precautions we have to take are that the GLP-1s can certainly affect gastric emptying,
Mm-hmm.
and we do ask patients to stop them before surgery, and depending on what surgery they're doing,
Mm-hmm.
the time frame by which they ought to stop it is variable. It used to be a month, now it's down to about a week.
Oh, okay.
So it depends on the operation. And the anesthesiologists who help us with the anesthesia for the patients, they're also modifying their rules a little bit as we learn more and more, because the GLP-1s have not been around for very long.
Right.
But it does bring up a very important point, Courtney. In terms of the mommy makeovers, and particularly the body contouring,
Mm-hmm.
the best long-term result for our patients is going to be those who are close to their ideal weight.
Right.
And what we don't want to have is a patient who is starting out at a notable overweight situation and trying to get us as the plastic surgeon to kickstart their weight loss journey.
Right.
That's not the way to think about it. Even if you have liposuction or a tummy tuck, yeah, you are going to lose a little bit of weight, but that's not weight loss.
Right.
Weight loss is weight loss, and everybody knows what that means. So if we want to have a good long-term result, we want to get to either our ideal goal weight, and they're not necessarily the same,
Yeah.
or a plateau weight. The plateau meaning we don't expect a lot of weight loss or fluctuation after we get to this weight, whatever that is. And so I'm not going to be punitive to my patients who might be 10 or 15 or 20 pounds over their ideal weight based on the height weight chart or BMI charts. But I want to find out in the history that I take from them where they were and where they are. And if they
Right.
tell me I'm at my highest weight right now, but I plan to lose 20 pounds, the timing of surgery becomes very important.
Right.
We'll tell them everything they need to know about their surgical journey, but we might say, let me see you back in 6 months or 9 months and see if now is a better time.
Right. And then if they want to continue the GLP-1s after the surgery, whether it's low maintenance dosing or micro dosing, which is hit the world very fast. What are your thoughts there? Are you able to pick it back up, or?
One is generally able to pick it up quite quickly after
Yeah,
surgery.
very good.
There are very little down consequences. The only thing we want to make sure is that a patient is meeting their nutritional needs
Right.
after surgery. We don't want a semi-starvation diet when healing, because we don't want you in a protein deficient state. We want to make sure that your healing incisions and
Right.
wounds have all the nutrition and nutrients that they need to heal properly.
When looking at, still on the topic of a mommy makeover, what if someone gets pregnant after their mommy makeover, a year, 2 years? I'm
Great
sure that
question.
happens, but tell us that process.
Sure, great question. So, as a general rule, we want, first of all, anyone who has a tummy tuck, can they get pregnant again? Yes, they can,
Yeah.
and their tummy will stretch out, I promise. But we generally recommend that a major surgery like a tummy tuck or a major breast lift should probably occur after all the pregnancies are expected.
Right.
If there's a surprise pregnancy after the fact, that's fine, and that's a reason to celebrate. But it may undo a little bit of the benefits achieved by whatever surgery one had, because the whole goal was to correct any stretching or drooping.
Right.
And again, because we talked about the pregnancy and post-pregnancy changes, some of that might get undone a little bit.
Very good. So if someone is ready to begin, ready to start the process, learn more, tell us those steps coming into your office for a mommy makeover specifically.
So the first thing they want to do is have a good understanding of what they're trying to improve. What is it that bothers them? What do they want to talk to us about? And that's really all the preparation they need. They need to have their mind pretty clear about what bothers them, and to learn about how we can help them. What are the options?
Very good. And then what is the scheduling time? They come in, they are ready to go. Are you able to get them in quick, or what does that look like?
Yeah, we usually can get our new patients in fairly quickly. And the surgical schedule, it just depends, on our schedule and the hospital availability of the operating room. But I do want to address one other question that comes up, Courtney, with regard to timing.
Yeah.
If a mom just finished nursing and she's got 1 or 2 or 3 children under 6, she's got a busy household, and she's got a lot of responsibilities. And so the logistics of the home are a factor that one may not think about. If one is just looking in the mirror and saying, I don't like this about my tummy and my breast, let's go fix it. You got to make sure that the house doesn't fall apart. The kids are looked after. So one has to be sure that there's enough help at home for recovery, that kids are getting dropped off at school, that grocery shopping and laundry is getting done, all the things that a busy household with kids needs, because mom is not going to be super mom when she's recovering from surgery. So we've got to make sure that those bases are covered.
And one last question. So those mommy makeovers, is there a specific age, or is it really for an array of different age groups? What is that? What are you seeing? And then is there an age where it's not really suggested?
That's a great question, and I would say that age in and of itself is not a disqualifier.
Very good.
If there's a relatively young mom who's had 3 kids by the time she's 29, she's a candidate for surgery. If it's a mom who had her last kid at 45, she's a candidate for surgery when she feels she's ready. So, nope, age is not a disqualifier.
Very good. Well, thank you so much for kind of going over the mommy makeover process, and hopefully our listeners have minimal questions but are ready to take the next step if that's what their journey is calling. So
great. Thank you, Courtney.
Yes, of course. Thank you, Dr. Kalus.